YouTube channel is just discussing with you the importance of MDCAT, that is the Medical and Dental College admission in Pakistan. And today I am just talking in English because I want to share the Aga Khan University program of its test, which is very near. So the international students as well as the students in Pakistan can prepare. The last date of the filling the form for the Aga Khan MBBS, as well as they had a dental assistant admission test. So the form filling last date is 8th May. Today is the 5th May, and still 2 days are there. I shall request to the Aga Khan University, because of the prevailing situation in Pakistan and the other difficulties, I think the admission date from 8th May should be extended for at least for 2 weeks or 15 days, so that the rural area people and people from Pakistan and other countries can prepare with confidence. So I hope this request will be accepted. And the test date is July, which is 20th July, and it has 11 centers in Pakistan, including Hyderabad, Sakkar, Karachi, Multan, Chitral and other things, and almost 13 centers in the overseas. And for the 100 seats, I think these centers, which are internationally, which includes the Kabul, Iran, as well as Riyadh and London, Nairobi, Darussalam. So I think the students are the overseas Pakistanis, are expatriate, are the nationals of other countries, but with Pakistan background can avail this opportunity. And the 20th July is still quite away, so they can prepare for the test, and the test material curriculum is available. But for the admission, even the pmdc test, which is MDCAT, is considered compulsorily. So I think this will create a lot of YouTube channel is just discussing with you the importance of MDCAT, that is the Medical and Dental College admission in Pakistan. And today I am just talking in English because I want to share the Aga Khan University program of its test, which is very near. So the international students as well as the students in Pakistan can prepare. The last date of the filling the form for the Aga Khan MBBS, as well as they had a dental assistant admission test. So the form filling last date is 8th May. Today is the 5th May, and still 2 days are there. I shall request to the Aga Khan University, because of the prevailing situation in Pakistan and the other difficulties, I think the admission date from 8th May should be extended for at least for 2 weeks or 15 days, so that the rural area people and people from Pakistan and other countries can prepare with confidence. So I hope this request will be accepted. And the test date is July, which is 20th July, and it has 11 centers in Pakistan, including Hyderabad, Sakkar, Karachi, Multan, Chitral and other things, and almost 13 centers in the overseas. And for the 100 seats, I think these centers, which are internationally, which includes the Kabul, Iran, as well as Riyadh and London, Nairobi, Darussalam. So I think the students are the overseas Pakistanis, are expatriate, are the nationals of other countries, but with Pakistan background can avail this opportunity. And the 20th July is still quite away, so they can prepare for the test, and the test material curriculum is available. But for the admission, even the PMDC test, which is MDCAT, is considered compulsorily. So I think this will create a lot of council. They are reviewing the process of the MDCAT. So the Aga Khan University and the National University of Medical Sciences, which is under the Army, I think these are important institutions, and a separate meeting should be held with them, and the balance should be worked out, that if a student is appearing in the Aga Khan test and also appearing in the MDCAT, and if there is some kind of common grounds or common curriculum that can be used, and one test can be considered for the admission, either from the NUMS, either from the Aga Khan, or either from the PMDC. It should not overlap or duplicate the efforts of the students, and that will lead more confusion and complication. So the pattern should be the same. I understand that there are 100 questions in Aga Khan test, and there are 200 questions in National University of Medical Sciences or NUMS, and the weightage is different. Interview and other considerations are with the Aga Khan, and even the competition is with the international students. So I will request to the Sindh government also that the students of the Aga Khan University, if they are admitted from the Sindh province, then they should provide financial support, and same should be provided to the National University of Medical Sciences, and even the Higher Education Commission is providing over and above 300 plus seats to the Balochistan and FATA students, so that they can be supported. And I think the underdeveloped districts of the Sindh, particularly the water shortage and the agriculture failure, climate change is affecting the province of Sindh, because it is in the tail, and the most of the people are dependent on the agriculture sector. It is one of the important area to consider, and even the floods affected 2022 almost 330 million people in badly, and still they are not in a position to recover from that shock. So with this, I think the MDCAT nowadays is to be realized as touching 40-50 degrees centigrade, and even in Balochistan and in Multan and other areas. So I think to be the conduction of these tests during these hottest month of the year is, I think, unfavorable, while in the Europe and many other countries, including Kabul, the weather is quite cold and comfortable. So I think these ecological and environmental factors should also be considered, and mostly from Sindh and from Pakistan, girls are outnumbering the boys, so we should think that there should be balance, and seats should be divided equally between male and female, and that will be the gender balance also. And if females are more interested in the medical field, they can be given nursing and other fields as an option, so that the medical manpower required in the hardest area, in the difficult area where there is no light, no electricity, so I think that should be considered. Pakistan Medical Dental Council is requested that they should also change the mind to conduct the MDCAT in the hot month, so they should shift it to the September, which is the normal months of the MDCAT in the previous years, but it should be held at a local level by the local college under supervision of the Pakistan Medical and Dental Council, not practically bringing the papers, pencils and logistics from one corner of the country to other corner. I think the Pakistan Medical Dental Council staff, as per the available figure, is not more than 300. How they can handle 3 lakh students and about 60 to 100 centers in Pakistan? This is not practically possible. This is one point, and if they have supported the FATA and Balochistan students, I think the overall more than 500 seats should be increased this year and the next year, so that the students can be accommodated. I will suggest that because of the prevailing situation on the borders, the message is that the armed forces and the establishment should consider that the army medical colleges can be outsourced for at least 5-6 years to the local civil society, NGOs, or the regular universities, so that the focus of the armed forces should be on the borders and to the security side, not to the medical side, because in the previous many decades, the civilian doctors were inducted in the army after MBBS, given 6-month training, and they were serving the army and providing the health care needed. So I think this kind of approach should be adopted and considered and reconsidered at the top level, and that will help the private sector, civil sector, or the public sector, both to have more colleges but a streamlined medical education. After this, I think I will just touch to the field of philanthropy, which is part of the medical field. I will just give a brief account of one of the philanthropists of the USA called Chuck Feeney. He was born in 19 October. That is the date, which is October is 1931, and died in 2003, and that person actually became millionaire and billionaire, and supported almost 900 healthcare facilities in Vietnam, and the University Cornell, from which he was graduated, donated billions of rupees and converted that university. And even he was from the Irish background, but he was living in the New Jersey when he was born. He was from the middle class family. He could not be the doctor, but he was business minded and got education in the hotel management, and sold pakoda, sambosa during his studentship. So with that, you can see that if you are not doctor, you can use your resources, talent in other fields. And if a person like Czech on Vietnam and other countries, and even a university in Ireland, Limerick University, and also a high level of Institute of Technology, I will request the people of Pakistan that if the Chuck Feeney can donate its entire life as well as fortune, which was more than $8 billion US dollars, then the philanthropist of the Pakistan should come forward and support the medical education, medical universities, medical students, as well as the general education, so that we can have our own homegrown Pakistani doctors, Pakistani physicians. We have one of the Center of Excellence College of Physician Surgeon, where from I got my fellowship. It is one of the well recognized and a leading institution in the world. So we can support and create and recreate institutions, as well as our doctors are highly trained in the curative care. When person is sick, then they start their diagnosis and laboratory test. So prevention is better than cure. So we need not only the doctors but good nursing cares, because 60% of the health care is nursing, 40% is the medical. And Aga Khan is following this kind of paradigm shift, and we should follow it. And with this, I think those who are appearing in the intermediate and metric, I think the board examination are crucial. They are the foundation. So I will request the board chairman as well as the PMDC to change the pattern of the MDCAT from board mark portion or weightage is 50%, and the 2 hours test is 50%. So I think the MDCAT weightage should be 30%, and board intermediate weightage should be 70%. This will give students easy access to access the medical education. With this, Dr. Hussain Bashkolati YouTube channel will provide you the latest information. And once again, I will salute the Chuck Feeney, who himself born on April 23, 1931 in New Jersey, and died on the 9th October 2023. With this, I think the video and vlog, I salute Chuck Feeney, and this will give an alternative path to the doctors, that if you are not doctor, you can be philanthropist, you can be businessman, and you can establish and serve not only few people, few thousand, but the countries like Chuck Feeney has served 150 countries, and 1,000 buildings were constructed, and there is no name of the Chuck Feeney on any building. He was so simple. He lived in the rented apartment and passed his life at 1992 without any major sickness, with happiness, and left